we did a single center assessment of the efficacy of CPX-351 in patients with known antecedent hematologic disorders, not just including MDS, but also CMML, myeloproliferative neoplasms, and MDS-MPN overlap syndrome unclassifiable. And I think that probably one of the take-home messages from this particular abstract was that we studied the rate of mutational clearance in these patients with AML from AHD, and we found that approximately 40% of patients with treatment after treatment with CPX-351 cleared their mutations by typical NGS techniques, and about 60% did not. And the patients that cleared their mutations had a better relapse-free survival than those that did not clear mutations. Yet the overall survival in this single center cohort was unchanged between the two groups based upon clearance versus no clearance. We did see that there were benefits, I guess, to having AML from MDS as compared to AML from CMML or MDS-MPN unclassifiable when it came to response likelihood and survival from after CPX-351. But overall, I think that this study also confirmed the efficacy of CPX-351 in patients with antecedent hematologic disease with, interestingly, fairly high rates of mutation clearance after CPX-351, and I think that's an important observation when you consider potential mechanisms for overall benefit with CPX compared to 7+3 in terms of perhaps a higher likelihood of achieving a deeper molecular remission. So these are observations that need to be confirmed in further studies, but I think reaffirm some of the data that we know all about already with CPX-351 and also highlight some new findings that I think deserve additional follow-up as well.